In this lecture, we're going to be studying anatomical terminology. So you could think of this lecture as bread and butter for being able to be successful in an anatomy and physiology class, and you're going to use these terms in any medical career. So learn these forwards, backwards, upside down. You're going to need to know these anatomical terms in order to be successful in the class. So let's get started. Now, we're going to be looking at anatomical terms dealing with the regions of the body, the planes of the body, the cavities of the body, the membranes of the body. But to start it all off, we have to know that everything we're talking about is from what's called anatomical position. So this is our starting point. This is referring to the position that the patient would be in if you were, for example, a doctor working on a patient. So this figure here shows a person in anatomical position. So we're dealing with the perspective from the patient. So the patient's left, not your left. The patient's right, not your right. So notice that for anatomical position, the body is up straight, so it's erect. Okay, so I have a Barbie here, so she's perfectly straight. Feet are slightly apart, but notice that the feet are facing forward. And perhaps most importantly, the palms are out. The palms are facing forward. Okay, so you don't have the back of the hand facing you, you have the palms facing you. So don't forget that. Notice that not only are the palms facing you, but the thumbs are pointed externally. Okay, so I can't really show you in a camera. No. So not only are the palms facing you, but the thumbs are pointed externally to the outside. Okay, so this person is in anatomical position looking at the front side, also called the anterior side, which we'll go over in a little bit. And here is the back side of a person in anatomical position, or the posterior side, which we'll also go over that term in just a little bit. So notice that from the back side, the hand, you're looking at the back of the hand, but again, thumbs still facing away from the body to the outside. So all the directional terms we're going to go over in this lecture and use in this course are based on a person who is in anatomical position. So everything we talk about, assume the person is in anatomical position. So you're looking at everything from the patient's perspective. So the right side of the patient. So where would be the right side of this patient? It would be over here. And this would be the left side. So this would be the right arm. This would be the left arm. This would be the right knee. This would be the left knee. And from this perspective, this would be the right arm. And this would be the left arm. So I think you get the idea. It's always from the patient's perspective. Now, going on with our directional terms, I just mentioned to you the terms anterior and posterior. Oh. Now, moving on with our directional terms, we're always going to go from posterior or anterior. So you heard me just say the terms anterior and posterior. So these are directional terms that are also bread and butter. Again, we're assuming the person is in anatomical position. So we see over here, this person is in anatomical position, feet are forward, palms are facing front, and thumbs are to the outside. But notice that the arrow is pointing away from the back of the person. So in other words, the back side is posterior. It also is sometimes referred to as dorsal, but that's usually when you're referring to like a four-legged animal. The back side of the four-legged animal would be dorsal. But when you're referring to a human, we usually say posterior. So posterior or dorsal means toward or at the back of the body. So behind. So for example, the head of this arrow is posterior to the body. And on this person, we see that the arrow is on the anterior side, so the front side. In four-legged animals, it's called the ventral side, but in humans, we usually say anterior. So that means toward or at the front of the body, or in front of. So the head of this arrow is anterior to this person right here. So the terms both refer to what side or perspective you're looking at something, and also you can use it in terms of where it is relative to something else. So we'll practice some of these. So we just talked about anterior versus posterior. So anterior in the front or towards the front, posterior behind or towards behind. Now we're going to go up versus down. So this is called superior if we're talking up towards the head. And it could also be called cranial because it's referring to the head. So superior means toward the head, toward the upper part, or upward. So notice these arrows from all these different perspectives of this person in anatomical. Okay, so we just went over the terms anterior, which means at the front or towards the front, and posterior, behind or towards behind. Now we're going to do two terms that deal with up versus down. So we're going to start with up. Let's go over the word superior. It's also can be called cranial, which should give you a clue. It means towards the head, or towards the upper part or upward. So you see 3 patients here, all in anatomical position, and the arrows are pointing upward towards their head. And so just like we said before, a structure can be superior, but it's always relative to another structure. So let's say here the head is superior to the umbilicus, right? The belly button, because it is upward from it. It's above it. So the opposite of superior or cranial is inferior or caudal. So again, caudal usually used when you're talking about a 4-legged animal because that refers to towards the tail. So humans, we don't really have tails. So we're going to say inferior as being the opposite of superior. So this means away from the head or toward the lower part or toward the tail or downward. So we have the arrows of this person facing down towards the feet. So we can say that the knee is inferior to the gluteal region, the butt region. Okay, so these are just opposites. Superior up, inferior down. Superior towards up, inferior towards down. Okay, carrying on. So we've now dealt with towards the front, which is anterior, towards the back, posterior, towards the top or upward, superior, downward, inferior. Okay, so now we're going to talk about lateral. So lateral means away from the midline of the body or towards the outside. So we have lateral arrows here. So there, notice that both of these arrows are pointing away from the center or the midline of this person who's in anatomical position. This is your anterior perspective or your anterior view of this person showing things lateral. And here's the posterior perspective looking at the backside. But again, the arrows are both pointing towards the outside away from the midline. So again, these are directional terms that are relative to other terms. So here, if we're going back to the umbilicus, the belly button, we can say that the arm is lateral to the belly button. Or we could say, for example, like here's a clavicle area here, the left clavicle of this person. So you could say that the deltoid, or the muscle over the shoulder, is lateral to this clavicle. So everything's relative to something else, right? Okay, I think you're getting it, and we're going to practice these. Now, of course, because we just went over lateral, we have to do the opposite, which is medial. Medial. So medial, think of it, sort of sounds like middle, right? So that means anything towards the middle of the body. So toward or at the midline of the body or on the inner side of. So this is medial. So let's look at the arrows of these guys over here. So they're in anatomical position. We see that both arrows are pointing towards that midline in both the anterior perspective and the posterior perspective. The arrows are pointing towards the midline. So we could do the opposite of what we just did on the previous slide, and that is say the arm, well, we said before the arm was lateral to the umbilicus. We could also, the opposite of that would be the umbilicus is medial to both arms, right? It's more towards the inside. So now you could also have something be intermediate, and that means it is somewhere between lateral and medial. So for example, you could say that, going back to that left clavicle we were talking about up here, this left clavicle area, you could say that is intermediate between the umbilicus and the left arm because it falls in between those two areas. So just more terminology that we can use. Okay, here's two more terms, proximal versus distal. So proximal, think of it as in proximity, right? It's near. So it means closer to the origin of the body part. Closer to the origin of the body part. That means where that body part starts, where it stems from. So put it this way. Let's say we have a foot versus a hand. The hand is more proximal to the neck than the foot is. So it's nearer. Whereas distal is the opposite. That means further away from. So the foot is distal to the hand. So it's farther away. So proximal, closer to the origin, distal, further away. And finally, we have directional terms dealing with how close something is to the surface or how deep it is. So we have superficial as the term that means toward or at the body surface. Sometimes it's also called internal, but the idea is that and two more terms here. So you can look at something as how deep into the body it is or how close it is towards the surface. So two more terms that are opposites of each other. Superficial, also called external, or deep, also called internal. So you can see on these diagrams here, we have superficial, the arrows are all pointing away from the core of the body towards the outside, versus in deep, that says deep right there, the arrows are pointing towards the core of the body and away from the surface. So, so this is important when you're studying different terms of the body. You need to know, for example, if you were trying to cut something or do a surgery, you would want to know how deep you're supposed to go, how, where is one organ inside the body relative to one maybe that it's underneath or something like that. So, so for example, you could say the skin is superficial to the liver because it's more on the outside. Or the opposite of that would be, the intestines are deep to the skin. That means they're more internal to the skin. Okay, so let's just real quickly recap some of these terms that we talked about. So we talked about anatomical position, where feet are forward, slightly apart, body is erect, arms are at the sides with palms facing forward and thumbs to the outside. We talked about the front of the body is the anterior direction or region, and the back of the body or towards the back is posterior. Towards the head is superior, towards the feet inferior. Proximal, closer to the origin of a body part. Distal means further away from the origin of that body part. Superficial, towards the outside. Deep, towards the inside. So I hope you are able to get these terms down, and you can play lots of games where you use the terminology to relate one thing to another. So now that you know the basic anatomical directions, we're going to go over anatomical planes. So this is especially important when you are doing dissections or surgery. You need to know what planes to cut something. So the planes refer to the surfaces for cuts in any anatomical study. So we're going to go over the terms sagittal, frontal, also called coronal, transverse or horizontal, and oblique. So let's start with sagittal. And so you can see the sagittal plane right here. So basically a sagittal plane is going to go straight down. If you were going to cut something, you would cut them straight down like this. And basically you're making it so that you have two halves if it's straight down the midline. So you can see this person here has a cut straight down, which would divide it into a left and right side. And what's kind of cool is this picture here is an MRI photo of a cadaver where the MRI cut it straight down through the sagittal plane. So straight down like that. And that divides the person into two halves. So that's the sagittal plane. So you're dividing the body into right and left. And sometimes you can also have another term. If you're cutting it exactly straight down along the midline, that's called a mid-sagittal plane or a median plane, because median refers to middle. But that's only if it's cut perfectly down the center. If it's a little to the left or a little to the right, it then becomes a parasagittal plane. So it's where the cut is not center, it's slightly off center. Okay, so that would be parasagittal. A frontal or coronal plane, imagine wearing a headband where you're, and imagine that headband would just cut straight through you. You'd have an anterior part of your body and a posterior part of your body. And so you're dividing the body into anterior and posterior parts when you make a frontal or a coronal cut. So you can see this person here, imagine this this tinted area here is like a knife, and you'd cut them just like a headband, and you end up with an anterior side, and then around the back you'd end up with a posterior side. You can also make a cut that is transverse, meaning you basically are making a cross section. So if we have Barbie here, cut her like this, she'd end up with a superior part and an inferior part, right? So you're making a cross section. And here's an MRI through a person where you can actually see that you're looking down, on the cross section part of the person. So you're dividing them in half. Whereas contrast that with the frontal plane, the coronal cut, here's an MRI where you're looking at, just part of the front or the back of the person. There's one other kind of cut that I don't have a picture here to show you, but that is an oblique cut. So oblique refers to kind of a diagonal. So if here's Barbie, I'd be making a cut diagonally like this or like this. So, or even if it was a sagittal cut, it could be an oblique sagittal cut. So it just refers to cuts other than 90 degrees. Okay, so now you need to learn your anatomical regions, and there's a lot of them to learn. And yes, you do need to learn the names of all these anatomical regions, part of what makes your study of anatomy and physiology fun. So we're going to go through all of these, but you're going to be practicing these. So notice that we have in bold here some more macroscopic. So notice that in bold, you have sort of the larger category of the region. And then in unbolded in this picture, you'll have what regions are found within that larger category. So let's look at cephalic. So cephalic refers to the head region, and that's broken into the frontal, the orbital, the nasal, the buccal, that's the cheek, your oral, which obviously is the mouth, and your mental, which is your chin region. So those are kind of like subregions of the cephalic region. So we're going to go over all these in more detail. Cervical refers to the neck. Thoracic refers to the upper part of the torso. Abdominal refers to the abdomen. That one's easy. Pelvic refers to kind of this region around here that includes the groin. Pubic is specifically to the genital area. You have your upper limb. You have your lower limbs, which are your legs. So upper limbs would be the arms. Lower limbs are your legs. Pedal refers to feet. Think of pedaling on your bicycle with your foot. And manus refers to hand. So mano a mano. So manus refers to hand. And you can see lots of terms to learn within those that we're going to go over. The back is also your dorsal region. It's also your back region. And then, we're looking at the back of the cephalic and the cervical regions here. So let's get into this in a lot more detail. You're going to need to learn all these terms. So let's start off with how we can divide the body up into different quadrants or regions depending on what you're interested in. So let's first start off with the 4 abdominopelvic quadrants. That's a mouthful. Abdomino, that refers to abdomen, pelvic region, quadrants, because there's 4 of them. So we're looking at this person here from an anterior side. And what we're going to do in this abdominopelvic region is we're going to divide it into 4 quadrants. And remember, the person's in anatomical position, so we're looking from the person, the patient's perspective. So over here, we'd have our right upper quadrant, or RUQ. Over here, the left upper quadrant, or LUQ. Down here is the right lower quadrant, or RLQ. And over here is the left lower quadrant, LLQ. So not too hard, right? Right upper, right lower, left lower. What's a little bit more tricky is the different kinds of organs you'll find within each quadrant, which is really why medical professionals use the 4 quadrants, because it helps them to say, okay, for example, if a person's having a pain in their right upper quadrant, well, we need to focus on looking at the organs that are in the right upper quadrant, which are the liver, stomach, gallbladder, duodenum, right kidney, pancreas, transverse colon, and right adrenal glands. So you can see these labeled on this model here. So, here's transverse colon. We'll be learning that when we do the digestive system. Here's your liver. Here's the gallbladder. Duodenum is just this kind of first beginning of the small intestine. Right kidney, which is deep, so it's hard to see here. Pancreas, which is also deep, and a right adrenal gland, which sits on top of the kidney. So that's what you'll find in the right upper quadrant. And then you're basically dividing these quadrants by the different planes that we just talked about. So you have a mid-sagittal plane going down here, whereas you have a transverse plane here. So both this mid-sagittal and this transverse plane are going to cross at the umbilicus, or the belly button. Let's take a look at the right lower quadrant. So we're going to have the small intestine is found there. part of the large intestine, including the cecum, the appendix, right at the end of the large intestine, and some of the reproductive organs, like if this is a female, the ovary and fallopian tube. If it's a male, the spermatic cord. Over on the left upper quadrant, we have another part of the liver, the left adrenal gland sitting on the kidney, deep to these organs. The left kidney, deep. Pancreas, deep to the stomach, and the spleen, which is also deep, so you can't see it here. The other part of the transverse colon, and part of the small intestine. And finally, at the left lower quadrant, we're going to have the small intestine, part of it, part of the large intestine, the left ureter, which you can't see here because it's deep, and some of the left side of the reproductive organs, again, fallopian tube and ovary if you're a female, or spermatic cord if you're a male, and the sigmoid colon, which is kind of the last part of the colon there. So again, the purpose of these 4 abdominopelvic quadrants is to help medical professionals know what organs they're dealing with, or what parts of organs they're dealing with when they're examining a person. So it's important for abdominal assessments. And the other thing that's important for you to remember is that it's divided by these transverse and mid-sagittal planes through the belly button being the point of cross. Now, while the 4 quadrants are important for medical professionals, Now, while the 4 quadrants are important for medical professionals, for anatomists, they really like to get into the very specific. And so they tend to use the 9 abdominopelvic regions. So instead of just 4 quadrants, it's going to look more like a tic-tac-toe board, dividing the anterior part of the body in the abdominopelvic region into 9 different little subsections here. So here is labeled on this person in anatomical, well, I guess he's not in anatomical position, but sort of an anatomical position. So labeled on this picture, you'll see the abdominopelvic area divided into these 9 regions. So going down the middle, let's start right smack in the middle, which is the umbilical region, which of course contains the belly button or the navel, as it were. But in terms of organs, it's also going to contain the stomach, pancreas, small intestine, and transverse colon will all be found in that region. Above that is the epigastric region, and epi means above, gastric refers to stomach. So this is the epigastric region. So obviously we're going to have also the stomach here, part of it, and the part of the liver, the pancreas, and the right and left kidneys in that area. And then down below the umbilical region, we have the hypogastric region, also called the pubic region. So hypo means below, gastric means stomach. Pubic, of course, refers to, the pubic area. So in the hypogastric region, you're going to have part of the small intestine, the sigmoid colon, and the bladder. Now going over to the right side of this person, you remember we're from the perspective of the patient. To the right of the epigastric region, we have the right hypochondriac region. Now, in this case, hypochondriac is not referring to someone who thinks they're always sick. Chondriac is going to refer to the ribs, and hypo means below. So that tells you that on this right side, it's found below the ribs, because hypo means below, chondriac means ribs. So right hypochondriac region. Below that, we have the right lumbar region, and you've probably heard of the term lumbar when we're referring to part of the back. So right lumbar region. And below that, the right iliac region, or some books call it the right inguinal region. So choose the term you like. I'm going to stick with iliac here. So this is the right iliac region. So right iliac region is going to have part of the small intestines, the appendix. So when someone has appendicitis, the doctors are going to be using the term right iliac region a lot for where the pain's coming from. And cecum and ascending colon. And I think I didn't mention the right lumbar region. We got a little bit of just the tip of the liver, part of the small intestines, ascending colon, and the right kidney. And in the right hypochondriac region, part of the liver, the gallbladder, so another important region. People get pain if they have, for example, gallstones, and the right kidney. Moving on over to the left side of this person is very easy. If you learn one side, you kind of know the other one because it's just the opposite. So we have the left hypochondriac region, so left side under the ribs. And that's going to have part of the stomach, liver, little tip of the liver, left kidney, and the spleen. So that's important there, is that it contains the spleen. Left lumbar region is to the left of the umbilical region. That's going to have part of the small intestines, descending colon, and left kidney. And finally, we have the left iliac or left inguinal region, and that's going to have also part of the small intestines, descending colon, and the sigmoid colon. So it's pretty easy to learn the terms of these 9 regions. Not as easy to remember what organs you're going to find within those regions, but you should know that because it's really going to help to know where problems are and where what you need to focus on when you're trying to treat a patient. So notice that in terms of how you divide up this tic-tac-toe board, just like with the quadrants, we're talking about planes and where, for example, you would make a cut. So notice the 2 vertical planes here are called mid-clavicular. Didn't say that right. So the 2 vertical planes here are called mid-clavicular planes because your clavicles, on right here on either side of the neck. And so these clavicle bones right smack in the middle of those, if you drew a plane all the way down, that would be the mid-clavicular plane. So we have the mid-clavicular plane, and then we're going to have 2 transverse planes, one that goes under the ribs and one that goes under the umbilical region. So that gives you your tic-tac-toe board. Now we can talk about the 2 major divisions of the body. So you're looking at a human skeleton here. And notice that colored in red here will allow you to distinguish the 2 major divisions. So for this skeleton right here, in red, we have the axial skeleton. So it's kind of the part of the skeleton that's the core of the body, right? So it has the head, the neck, and the trunk, including the spinal column here. So that's the axial skeleton. And we contrast that with the appendicular skeleton. Appendicular, and these are the limbs, right? So this would be, your arms, including the scapulae over here, and the legs, including the pelvis. So that is your appendicular skeleton. Okay, so we're ready to dive into those regional terms. And remember, those regional terms, there's a lot of them and it's very specific, but you're going to practice them, but you need to know all these terms. So we're going to go over first the head and neck regions. And remember that the head and neck regions are referred to as the cephalic region. So cephalic, when you hear that, think your head area. Okay, so that's your head and neck region. So we have here a person in anatomical position, and you're looking both at the anterior perspective and you're looking at a lateral perspective, right? You're looking at a picture from the side. So let's get started. So both of these areas here are the cephalic region, and we're going to divide that into the frontal region, which is your forehead, right? So frontal, otic, so that refers to your ear, is the otic region. Orbital refers to your eye areas. These are your orbits, right? So your orbital region. Buccal region is your cheek area, buccal. And nasal area, your nose. Mental is your chin. So that's the mental chin area. And then your neck is the cervical region. Okay, so cervical is your neck area, or your neck region. So let's practice these real quick again. So head and neck, cephalic. Let's divide it up. We got frontal, nasal, orbital, otic, oral. I think I left out on this picture here, but that's oral, mental, and cervical. Okay, so you got all those. There's one more, and that is if you're looking at the posterior side of the person, the back of the head, that is called the occipital region. Occipital. Learn these terms really well now, because what you'll find is when we get into studying the skeletal system, you will find the same terms used in many cases for different bones. So for example, while the back of the head is the occipital region, you'll learn later on that there's a bone back here called the occipital bone. You will learn that in the frontal region, there's a bone there called the frontal bone. So the more you can study these now, the easier your life will be down the road in this course. Okay, let's move on down to the thorax. So the thorax is the upper part of the torso. And we're going to go over these regions and again, learn these regions, because the more you learn it now, the easier your life will be later on in the course. So let's just go around the clock here. So we got a person in anatomical position from the anterior perspective and the back, the posterior perspective. Right here in the armpit region is called the axillary region. Axillary region. We got, your sternum bone goes right under there. So this is the sternal region. It's where your breastbone is, the sternal region. This, of course, is your abdomen. So this would be your abdominal region. So it's the stomach area. Right where the umbilical cord came out, or where your belly button is, your umbilicus, that would be the umbilicus region. So that's the belly button area. Your shoulder is the acromial region. And that term acrome, you're going to run into when we do the skeletal system. So this is the acromial region. The entire chest area here is the thoracic region. So that's more the larger category here, the thoracic region. Flipping the person over, here's the acromial region from the posterior perspective. Here's your vertebral region, because it has the vertebrae. So this is your spine area, vertebral. You have your scapulae bones under here. So this is the scapular region. So your shoulder blades. There's the axillary region, the armpit area from the back. And your lower back is called the lumbar region. Okay, let's move on down the body and go over the pelvic anatomical regions. So we're looking at the lower area here. So below the umbilicus region, we have the pelvic region. So really this area right here. And then moving on down, so in the hip area, we have the coxal region, inguinal region here. And remember, we ran into that term before when we were doing the 9 regions. So it really refers to the groin area. So, but contrast the groin area with the pubic region where we're talking about the actual genital area. So those are 2 different regions. So inguinal is going to be kind of superior to the pubic region. We have the perennial region. So this is a region between the anus and the genitals. And many women out there will know about their perennial region very well because a lot of women have to get a surgery when they're going to have a baby. If the birth canal is not wide enough, a lot of times the doctors will make an incision in the perennial region to make it easier for the baby to come out, and then they have to sew the person up, and it takes a long time to heal from that. So that's the perennial region. Flipping the person over to the posterior perspective, so you again have your lumbar region here. Very low, so inferior to the lumbar region, we have the sacral region. So it's kind of the lower tailbone here. That's sacral. And when we get into the skeletal system, you'll learn about a sacrum. So this is the sacral region. You can see your coxal regions here again. And the buttocks is the gluteal region. And then, of course, you have the backside of the perennial region as well. So those are the pelvic anatomical regions. Let's get into the appendicular areas here, the limb areas. So once again, we have our armpit, the axillary region. So you got your axillary region, but now moving down the arm. So we've already talked about the acromial region, which is the shoulder area, and of course the armpit. But now the upper arm is going to be called your brachial region, brachial. And the forearm is called your antebrachial forearm area. So antebrachial is your forearm. Flipping the person over, so where we're looking at the back side of your arm, of course, we've already talked about the scapular region up here, but on the arm, the elbow area is called the olecranon region. Olecranon region. And that's because there's a bone there, or a part of a bone called the olecranon, which is your elbow. So olecranon region is going to be the elbow area. Let's look at, okay, let's go ahead and look at our hand, the manus, right? So, so the hand region is the manus region, but looking in more detail, so your wrist is going to be the carpal region, and if you know anybody with carpal tunnel syndrome, that'll help you remember that. So that's the carpal region. Your palm is the palma region. That's pretty easy, palma. The thumb is the pollex region, pollex. And your fingers are called digits, so they're the digital region. So think about the digital age requires you to type on a keyboard, right, with your digits. So that's the digital region. So not just your fingers, but this also would apply to your toes. So your toes would also be a digital region. And again, the whole hand is the manus region. So you can see the anterior view and the posterior view where you're looking at the back of the hand. Okay, well, let's keep going down. We are now in the leg area, the leg anatomical regions. And so let's look at these legs. So we have an anterior perspective of a leg and a posterior perspective. So the shin area is going to be called the crural region. So let's take a look at the leg anatomical regions now. So we have the anterior view over here and the posterior view over here. So looking at the anterior region, so you start off with, and the posterior, you're going to start off with the thigh, right? So the thigh area is called the femoral region. And that's because the bone under there is the femur. So we got the femoral region. We have the area for the knee is called the patellar region because the knee bone is called the patella. So we have the patellar region on the anterior side, and we have the fibular region as being the outside of the shin. So remember, this person's in anatomical position, so we're looking at the person's right leg here, and so you can see the outside of the right leg is going to have the fibula, and so that becomes the fibular region. Now the shin area here is called the crural region. So the whole shin is the crural region. And now we're going to flip the person over to the posterior side. Of course, you have the gluteal region we've already talked about, so that's the buttocks area. And here's the femoral region from the posterior side. But the back of the knee area is called the popliteal region. So popliteal. So the front is the patellar, the back is the popliteal, and then the back of the shin, which is your calf, right? So the back area, your calf area, is called the Sacral Region. So it kind of rhymes with crural. So front crural, back sacral. All right, so that's the leg anatomy, leg anatomical regions. And finally, let's do the foot anatomical regions. So remember that the foot is referred to as the pedal region. The foot region is the pedal region because, I mean, for us, let's just remember that you pedal pedals of a bike with your feet. So it's the pedal region. So let's start off with your big toe. So your big toe is kind of like your thumb, right? So the thumb is the pollex. Your toe is the hallux. So, or halix, however you want to say it. So your big toe is the halix region. Your toes, as we said, are also digits. So this would be the digital region, the area where you'd find your toes. Underneath your foot, so if we're looking at Barbie here, so underneath her foot, the bottom side of the foot is going to be called the plantar region. So one of the conditions someone can get that I unfortunately have had before is called plantar fasciitis. It doesn't feel good, but it's in the plantar region on the bottom part of your foot. Your heel is called the calcaneal region. There's a bone there called the calcaneal. So this is the calcaneal region. And then the ankles are referred to the tarsal region because there are tarsal bones there. So tarsal region. And of course, we're back to the hallux, the big toe over there. So ankles are tarsal, heel is calcaneal, toes are digital, the whole foot is pedal, big toe is hallux, and then underneath is plantar. Okay, we're now ready to go over the cavities of the body. So remember how we talked about that life requires a separation between the internal and the external. And so these cavities that we find are various organs help to maintain that separation. So let's go over the dorsal body cavity and the ventral body cavity. So you might remember that dorsal is kind of like posterior, so that means towards the back, and ventral is like anterior, so that means towards the front. So the dorsal body cavity is going to have the function of protecting the brain and spinal cord structures that are within it. So, so the dorsal body cavity, you're going to find the cranial cavity within it that contains the brain. So that's the space inside your head that is going to protect the brain. And the cavity that protects the spinal cord, which is called your vertebral cavity. So the dorsal body cavity is made up of two subcavities, the cranial and the vertebral. So we got the cranial here, vertebral, protecting the spinal cord. The whole thing is the dorsal body cavity. On the other side, on the ventral side, we have the ventral body cavity, and we're going to break this into two sub areas, and then one of those will be a sub area. So for the ventral side, we have the thoracic cavity, which is basically the chest area, the cavity inside the chest that contains the heart and the lungs. And even that thoracic cavity is further divided into three subcavities. So we're going to have the superior mediastinum, the pleural cavity, and the pericardial cavity within the mediastinum. So we'll talk about those in a minute in more detail. But for now, just know that the thoracic cavity contains the heart and the lungs. And then it's separated from the lower part, the abdominopelvic cavity, through the diaphragm, the muscle called the diaphragm. So you can feel your diaphragm when you take a deep breath. You know, that thing that moves up and down. So that's the diaphragm. And below the diaphragm, we have the abdominopelvic cavity, which we're going to subdivide into the abdominal cavity and the pelvic cavity. So the purpose of the entire ventral body cavity is to protect the viscera, i.e. those vital organs. So obviously in the thoracic cavity, your heart and your lungs are very vital. And in the abdominopelvic cavity, we're having our digestive organs, your reproductive organs, you know, urinary organs. So they're all protected in that ventral body cavity and the subcavities within it. So let's take a closer look at, So let's take a closer look at that thoracic cavity within the ventral body cavity. So if we look at the diagram here of the thoracic cavity, and remember that we said it contains the heart and the lungs, but you'll see that it's divided. So you have your right and left pleural cavities within the thoracic cavity, and those house the lungs. So the right pleural cavity houses the right lung, and the left pleural cavity houses the left lung. Between those, we have a superior mediastinum. So it's just this little area here. And, you know, the trachea obviously is going to be inside of that. And below that, we have a very important cavity called the pericardial cavity. So that is where you find the heart. So the heart is within the pericardial cavity. So peri means round, and cardial refers to the heart. So it's around the heart. There's your diaphragm, and now we're in the abdominopelvic cavity, and we already said all the organs that those contain. So all those together make up the ventral body cavity. Now, there are other body cavities as well. So we've talked about the main ones, right? The ventral body cavity and the dorsal body cavity and all the subcavities that contains. But really a body cavity just means, you know, anything where there's an opening into the body from the outside, or in the case of joints, it's internal. So it's not exposed to the environment. But let's just take a look at some of these. So the ones that are exposed to the environment, we obviously have the oral cavity, which is your mouth. It can also be called the digestive cavity because digestion begins in the mouth, which we'll be talking about later on in the course. The nasal cavity, obviously, you bring air through your nose and it goes on down to your throat. So this is your nasal cavity. Orbital cavity refers to your eye socket. So your eyeball would be inside there. And you have a middle ear cavity. And so this is looking inside somebody's ear, and you can see that cavity right there that's open to the outside of the ear. So right inside of there. So that's your middle ear. And again, your joints, also called synovial cavities. So these are your joint cavities. Your synovial cavities are not exposed to the outside environment, but you can see these are these spaces usually filled with fluid, synovial fluid, that surround and cushion those joints. Okay, we're going to finish off our discussion of anatomy. Okay, we're going to finish off our discussion of anatomical terminology with the serous membranes of the body, also known as serosa. So we're going to go over three main kinds of serous membranes here. So first term, parietal serosa. So parietal refers to membranes that are kind of lining the cavities. So remember, we just talked about the pleural cavity is where you'd find the lungs. So on the inside of that pleural cavity would be a membrane. And so that would be the parietal serosa of the pleural cavity, or better known as parietal pleura. Pleura refers to lungs. So notice that this is showing you peeling a membrane that's lining that cavity. But then you're going to have a little bit of a space, and then you have another membrane, another serosa that's right on the organ. It kind of makes the organ glossy, helps to protect that organ from friction, and that's called the visceral serosa, because visceral refers to the organs. So we got parietal serosa lining the inside of the cavity the organ is found in, and then the visceral serosa lining the organ itself. So that helps to keep things nice and slimy so that, as you're moving or things getting moved around, the organ is not, hitting against that body cavity and causing friction and damage to the organ. So that leaves a little space between the parietal and the visceral serosa, and that's usually filled with fluid. And so that again helps to cushion and protect the organ. So we call that fluid serous fluid. Serosa, serous, so serous fluid. So it's found between the parietal and visceral serosa, and it's secreted by cells that make up those membranes. So both the cells of the parietal membrane and the visceral membrane will secrete that serous fluid to keep everything nice and cushioned and keep, that separation between the body cavity that organ's found in and the organ itself. Here is a heart, and you can see that this is also going to have a parietal serosa called the pericardium. And so you can zoom in here and see the pericardium there. That's lining the pericardial cavity, right? And then you have the visceral serosa called the visceral pericardium, which is lining the heart itself. And between those two, you're going to have some serous fluid or pericardial fluid. So notice that these terms get more specific depending on the organ you're referring to. So cardi refers to the heart. And remember that we were in the pericardial cavity. So therefore, the pericardial serosa is going to be referred to as the fibrous pericardium. It's made out of fibrous material, whereas the visceral, because you're talking about the heart, is going to be the visceral pericardium. So, it gets very specific depending on the organs you're talking about. Now, I know all about pericardium and pericardial serosa because I'm prone to pericarditis, which is inflammation of this lining around the pericardial cavity, the pericardium. Here is an actual photograph you can see of the heart showing the parietal pericardium there. So the lining of the pericardial cavity. All right, hope you can keep those straight. We also have, you have a transverse section here with an MRI of a cadaver. So you can see the peritoneal cavity, which is the cavity where you find the abdominal organs. And there's a pericardium. Oops. And there's a peritoneum, which is the parietal serosa lining that peritoneal cavity. So in this cadaver picture, you can actually see that lining right there. So let me know if you have any questions on that. So that explains the membranes, the serosa. That concludes our lecture on the terminology.